everybody. Thanks for being with us for our March meeting on a cold March morning. Um, I was happy last month to see everybody in person, but it's nice to have everybody together with us again. Um, as you know, we begin every month looking at our statistics and where we are relative to the months that have preceded us, and keeping in mind, obviously, the fact that one death is too many, and also that we think about people who lose their life in this struggle, not just in terms of the one person who loses their life, but in terms of the circle of people affected by that death. And if you take a very conservative number that there are 10 people affected by every loss, it sort of changes the perspective when you look at these numbers. But, and this really, as I say all the time, is a testament to your work and to our partnerships. When we look at the period from January 1st of 2025 to today, and we compare that to that same time period in 2024, we see that, and I again always say it is amazing to me that we have made this progress. We have had another 28% decline in fatal opioid related deaths, incidents, excuse me. So that 28% really reflects the kind of work that is happening and the progress that's being made. There is still, concerningly, a 30% uptick in the number of deaths using opioids, which we've determined to be someone who has died by suicide. And remember, that bar is very high for us. We only include something as a death by suicide when there is a note, when somebody has told someone. So we don't make that ruling lightly. There are probably some of the others that are deaths by suicide as well, even though we don't count them that way, just because the evidence is not that clear. So that, I continue to say, that points us towards a piece of work that we need to be doing, is in that area, the overlap between substance misuse and mental health. So I want to just mention again, as I said at the beginning, thank everyone who was able to join us in person last month at Leahy. That was really a great meeting. We're lucky to hear from former Secretary Marty Walsh on his personal story and learn a lot about what both the unions and the contractors are doing, addressing the issues of the opioid misuse on job sites. We'll be talking again about that in the coming months, because I really want to use some of that information as a place for us to grow going forward and to inform some of our work. So, and they also talked a lot about, again, something we've spent so much time on, making resources known to people and the stigma reduction piece. And I was really happy to see, it'd been a long time since we've been together in person. And one of the best things about this task force, I think, has been the connections that people make. And it was nice to see people connecting again in person, seeing old friends, meeting new people. Towards the end of that meeting, some folks were talking about their concerns around kratom. And 3 communities in Middlesex County, Dracut, Lowell, and Chelmsford, have recently moved to ban kratom. And today, that's what we're going to talk about. We're going to hear from 5 speakers this morning involved with these efforts, as well as from physicians who will share their concerns about the future of kratom. And for those of you who are unfamiliar with the term kratom, it is a tropical tree that is native to Southeast Asia. And in Southeast Asia, people have been using kratom for centuries. Products prepared from those kratom leaves are available in the United States, whether you buy them online or you go to a brick and mortar store. You can buy capsules, you can buy tablets, you can buy extracts. The very concerning thing is the number of people using these products is very high. According to the Substance Use and Mental Health Services National Survey on Drug Use, 1.9 million people in the United States used a kratom product in 2022. And the American Kratom Association itself estimates that it is a $1.5 billion a year industry. And it's important to know that one piece of the concern is that kratom products that are available here, whether you're buying them on the internet or you're buying them in a local store, are much more potent than those that are traditionally available in Southeast Asia. And kratom's an interesting drug because depending on the dosage, it can do different things. It can be a stimulant or it can be a sedative. Some people use it as an energy boost. Some use it to self-treat chronic pain, and some use it to treat opioid withdrawal. So it appears in lots of different places. Concerningly, it has a real lack of oversight. It's always surprising to me. When I was in law school, took a course in food and drug law. And as much as we all know there's all kinds of regulations for certain kinds of food, there's a whole lot of things that fly completely under the radar and aren't really regulated. Kratom right now is not regulated by the FDA, so there's no oversight mechanism to check the quality or the safety of what you're buying. And so you can go to a store, buy it in a legitimate store, and have really no idea what you're buying. There are no FDA approved prescription or over-the-counter drugs that contain kratom. And the FDA does continue to warn people that you should not be using kratom as a medical treatment. But if you, as we all know, in many areas, if you're buying a supplement that contains various things like kratom, that does not need the FDA's approval to be sold. So you can go anywhere, buy whatever kinds of supplements for whatever. As I said, it's got a pretty wide range. You want to boost your energy, you want to calm yourself down, you want to treat your chronic pain. You can buy a supplement that's got kratom in it, and it is not subject to the FDA regulations. So the other issue is the studies about what the effects of kratom are very limited. So this is not like you're taking a drug that's been given to thousands of people in controlled settings, and we know what the likely good pieces are, the side effects. We just don't really know that. And so we also don't know what, if any, effect kratom has in overdose deaths. But the CDC does say that in 2023, when it looked at overdose deaths in Massachusetts, it found evidence of kratom in 23% of those deaths. So almost a quarter of the opioid deaths in 2023, the person had some kratom in their system. Where they got it, whether it was connected to the drug that actually caused the overdose, we don't know that. And Massachusetts also does not have any regulations right now on kratom. It's considered a drug of concern. So I really commend the public health folks in Lowell and Chelmsford and Drake for taking that action. And I'm really looking forward myself to learning more about this and also learning about the kinds of efforts that we can be involved in. And I would be remiss at this point if I didn't, while we're commending the public health people, I see my friend Maureen Busby's here. And as many of you remember from some of our meetings, Maureen has really been leading the charge around tobacco, vaping products, and has recently had some great victories in cities where you would not necessarily think they would be willing to regulate all of this. So kudos to Maureen. This is a fight she's been waging for a long time and really making some progress. So thank you. I'm now going to turn the program over to Cesar Panigram. Cesar has been doing tobacco control work since 1999. And then from 2000 to 2009, he was the director of a 5-city tobacco control collaborative, which included Cambridge, Somerville, Chelsea, Everett, and Revere. And one of Maureen's latest successes was in Somerville. And Cesar's also an attorney. So from 2009 to 2011, he took a break from tobacco control to focus on the practice of law. Then he had enough of that. and went back in 2011 to become the tobacco control director for another collaborative, this time comprised of the cities of Lowell and Lawrence. And he's joining us today to talk about the Lowell Board of Health's recent ban on kratom. So thank you so much for being here this morning.
Yeah, thank you for having me. I appreciate the opportunity. Well, I think I should start by first saying that, based on my experience, I'm not an expert on kratom. I think kratom it's still such a new thing that not a lot of people can claim themselves to be experts in this field. And I came across kratom because I'm in stores, just like Maureen Bugsy is in stores doing tobacco control. We've seen some of these. We've been seeing them over the years, but not as much in my area to be a concern. But somewhat recently, people reached out to the city council in Lowell and to the Board of Health um, to basically express their concerns about the use of kratom. And one person brought up the fact that one family member is allegedly has allegedly died because of ingestion of kratom products. So the board took interest. The board decided to, address the sale of this product in the city, and I they asked me to write a proposal to do just that. So I wrote a proposal that would impose some restrictions on the sale of these products. Essentially, I proposed that these products would only be sold at adult-only vape shops, but the board decided to go above and beyond that and decided to ban or prohibit the sale, manufacturing, and distribution of these products in the city. Um, the product, like the Ryan has mentioned, comes in many different forms. It could comes as a tea. It can comes as pills. It could come as a liquid in a liquid form, like a 30 milliliter shot, like this one here. And you can see the pricing. It's not very expensive. This one here is for $13.46. Here's another one, same size shot, 30 milliliter. And once again, one more way in which it appears, but it also comes as a vaping product. And usually they follow the same ideas behind the sale of tobacco products. They want to make it very colorful, the packaging that is. They want to add flavoring to this. So this one here is a banana flavor vaping product, and it comes in many different flavors. This one is pina colada, and we have also in peach flavor, and the list goes on and on. In addition to coming in as a vaping product, it also comes as a tablet or pills. So usually these pills they come in 20 milligrams. This one is it comes with 4 tablets. Each tablet is 20 milligrams of kratom. This one is 50 milligrams. This one has a mango taste, 5 tablets. Each one is 20 milligrams. So as you can see, there's a bunch more here that I want to take a lot of time from the meeting. It comes in different forms, is being marketed heavily. You can see a lot of these places online. They're selling the products. And we just recently, let me just start by saying that the board decided to adopt a regulation. The regulation was adopted on December 4th. Since then, we had one violation. One vape shop in the city of Lowell was found to be selling these products, and they have been fined. But we suspect that they continue to sell this product, but not necessarily from the store. So it's a black market kind of thing now, because if you have local regulations that restrict the sale of these products at stores, people may decide to just buy them, sell them from their homes or from their cars, any other ways as they can see fit. There's been several bills that have been introduced since 2023. Most of these bills don't prohibit the sale of kratom. They restrict its sale by saying, well, no, some of these bills, they say, you can only sell to people 18 and above. Others bring their age up to 21. They look at the purity of the product, whether the product is contaminated with non-kratom products or where the product has been contaminated with dangerous products. So there's various iterations of the same bill. It's starting out with House Bill number 3762, followed by Daniel Hunt. This was done in 2023, but then there was another iteration in 2024, and then in 2025 it's been filed again. It has a different fining structure. It fines different amounts for different types of violations. So if the issue is addressing the purity of the product, then or the labeling of the product, then they have smaller fines ranging from $500 to $1,000. However, if it is a sale of the more dangerous product, contaminated with dangerous products, their fines go from $1,000 to $2,000 to $5,000 for first, second, and subsequent offenses. I want to show you a picture. This is from Pennsylvania. This is a kratom bar. At this kratom bar, people can just drink coffee, consume kratom, and throw axes. So I thought this was interesting. So this could be the type of establishments that we might see in the future if something is not done to address the problem. So that's pretty much it in a nutshell. We're going to continue to enforce the local regulation, and but I think at some point, more cities are going to join in. The ones that the Ryan mentioned. As a matter of fact, I think that Drake has also adopted a regulation addressing the sale of kratom. So hopefully, the state legislature will adopt a law that will address the concerns that most people have about this product.
Thank you so much. Thank you for that little background. I'm always the axe throwing places are always my favorite. As most people know, I'm from Somerville. Somerville's become quite an axe throwing capital. And the combination of alcohol or possibly kratom and throwing axes is something I really can't wrap my head around, but I'm sure it is a growth industry. Now we're going to hear from our friends from the Megan House. And I have to say, the very first time I heard the word kratom, it was from them about a year and a half or so ago. I know, and Mary Beth is here with us. Mary Beth Murphy is here with us. And I know that Pam Huntley, I spoke to her the other day. She's going to hopefully join us at some point. But Mary Beth is the Senior Director of the Clinical and Program Services at Megan House. And she spent over 27 years, really her whole career working in the substance use disorder field. She's worked in a clinical setting, supporting and guiding individuals who present with really different inner challenges. Her passion and mission is to promote independence while addressing the underlying very sensitive issues such as trauma, life changes, and stressors. Mary Beth earned a master's degrees from both UMass Lowell and Cambridge College, concentrating on human services and counseling. She maintains licenses as a mental health counselor and an addiction counselor. And she and hopefully Pam at some point will join us to talk about their efforts to ban kratom and their concerns about the substance and use by people in the recovery process. So Mary Beth, it's always good to have you here with us. You're muted.
Good morning. I'm not savvy with this stuff. I apologize. Thank you, everybody. What an honor. I can't deny what an honor, Lisa. When I contacted you, I right up the street from us, there's a four-way intersection, and this store opened up. It had the floaty things, the beeping light, all the light. It looked like a carnival, and it was all based on opening up a kratom store. So I had two of the younger staff go in so they, could check it out. And what they saw was extremely disturbing. And like Caesar said, with the potency, the flavors, the amount of product in the different shapes and forms was just mind blowing. And the flavors were really geared to younger kids, younger individuals, which was just disturbing, I think. And it's just sad because we're constantly fighting to save these lives and to try to do prevention and so forth. And then the market goes out there, um, like you said, DA Ryan, the $1.5 billion industry, that it's just sad that that money is driving this. So I am honored to be part of the crusade against Kratom. Lisa, you were fabulous to work with. Once I reached out to you, it was just, you guys just took it off. And I'm just very, very proud to be part of. Um, and I just want to bring the awareness, and I'm glad that people are doing something about it, that Drake and Chelmsford are on the same thing. And I hope it's contagious and a lot of communities follow suit. Um, just that's all I have to say. I don't think I can add to any more information what has already been shared about the drug, but I'm just glad of the awareness and the attention that it's been given. So thank you for having me and being part of this.
Lisa and Mary Beth, could you talk a little bit about how it all started in terms of the regulations? Like, how did the ball get rolling?
Well, about a year ago, PM and I were at a conference out in Atlanta, and we first became aware of it. And I think both of us were like blown away about it. So we had been introduced to it that way at the conference and gained some information. And then when we came back, the store just popped up, and I was at the four-way stop, and I couldn't believe what I was seeing. And so I started looking at if it's legal, looking into the background of it and so forth, and it's not regulated, nothing. And so I contacted the Board of Health, and what can we do? What can we do in our community? And from there, Lisa and at the meeting and with Caesar, they just took it running and addressed it. And I'm so grateful. And now that it's banned in Lowell.
So once I put it on the agenda, and Belchertown actually was the first one in Massachusetts that banned kratom. And one of my Board of Health members reached out to the Belchertown health director, and they had a packet that they had used, and she watched their public hearing, and she actually kind of got behind the cause, and she did some research behind it. And then, so my Board of Health actually is a physician, a nurse practitioner, 2 nurses, and a DCF worker. So it was the DCF worker who actually reached out and did a lot of research behind it. And she was kind of the running person behind it. And then when they first talked about it, they asked Caesar to write 2 regulations. So Mary Beth and Pam came to the meeting with Carrie Detremont from the Greater Lowell Health Alliance and spoke about it. And then, and we also had a couple of people come to talk for kratom. So we had a couple of meetings with people speaking for kratom as well. So it wasn't all against it. We did have people for and against. And then Caesar wrote a couple of different regulations to put it in over 21 stores, and then they had gone towards the ban. And then we went back and forth a couple of times, but one of the Board of Health members really was for banning it. And then they got to the point, because they're all science-based, that, as DA Ryan said, there are no studies as to how this really is affected on the body. And then we did have one person who came to all of the meetings, and she's from Drake, and her son was in Florida and used these energy drinks. And his death certificate only says that he died because of kratom. And she came to every one of the meetings that this was on the meeting with the death certificate. And she actually now has gone to all the Board of Health meetings in Drake, all the Board of Health meetings in Chelmsford, and now she's going to the Nashua Board of Health meetings. And she's actually called me, and I've had calls from multiple Board of Health members from all of these areas. And I don't taint them to say that they should do this. I just give them the packet that we used, and then they have used our ordinance, and then I also give them the information. So kratom actually has been banned in 6 states. Some states have actually just classified it as a drug. And I believe, and I don't know if it's correct because I don't know the legal thing, a class 1 drug, is that what it is if it's heroin? So if you're carrying it, you can be arrested.
Class A.
A class what? Okay, so,
Class A.
We
yeah,
do it by letters, so it's
Okay.
Class A.
okay, so a class A drug. So some you can be arrested for carrying it. So this is where kratom sits. So when the board saw that, that's why they did these different things. Sorry, that was long-winded, sorry.
What type of public awareness steps have been taken so that, I mean, that's a really concerning story about the woman's son. Oh my goodness. Like do you feel like folks are beginning to get the message?
So Caesar has done a lot of education, so we had to publish for the public hearing about kratom. There has been a lot of social media from the kratom for kratom, so they did a lot of social media for that. We have a city councilor who is an at-large city councilor, and he's done a lot of social media against kratom, and he has a big following. So he's done a lot of stuff against kratom, and that's brought a lot of awareness. The Lowell Sun, I think the DA actually had picked up the first time on the big Lowell Sun article when they said that the Board of Health had first spoken against it. They also did an article saying that we had banned kratom. So a lot of people have called us. We got a lot of people in favor, and then we got a lot of hate mail. I've got a lot of hate emails about it. So it has brought a lot of awareness to people about kratom. So yes.
How young is the are the other, you know, is the messaging going? Is it something that's making it into the schools? Do you know?
I haven't quite heard from anyone like high school age or anything, but we do have some at the health department, some prevention grants. So we do have people that go into the schools. I haven't necessarily heard that people talk about, any of the young people have talked about kratom. But we haven't seen kratom in any of our convenience stores. I know Chelmsford had mentioned that when they had gone out prior to banning, they do have kratom in their convenience stores.
I was just gonna
Nicole, did you have a question?
Yeah, so I'm from the town of Westford, and I do work with the Westford Public Schools, and we had a meeting about 2 weeks ago around vaping and products and such, and so this topic came up a little bit. So I've been trying to find something, you know, concrete to provide, and I've had kind of a challenge. So I don't know if that, as far as like prevention pieces, you know, as far as informing the school with the guidance counselors, the school nurse as such, that could be something that also can be shared with parents. Are we there yet as far as resources that way?
So we don't have anything, but Caesar does have those, like what he's showing you, if you want us to share that with you. Like, do you want like what it looks like? Is that what you're looking for?
Really anything, because right now it's a conversation, so just so I can have a follow-up.
Okay.
Anything as far as like parents or because it's there, the knowledge is there, but then it's kind of nice sometimes to be able to provide like a visual, or those visuals were fantastic, or I just don't know if we're there yet just because it's so new, whereas I can provide information around vaping, nicotine use programs, you know, as far as you know, if this is a piece where you're addicted, where you can go. I just don't know if it's still too new to be there.
I think the doctors will address a little bit of that. We can certainly put in the chat or send out to the list some of the articles. I mean, I think the scary part is there isn't much in terms of knowing what the impact is. I think the things that Cesar had about the pictures of it, because I think as a parent, you may not even know what it looks like. You know, what is this thing? I don't see any little bags of drugs in my kids' stuff, so it must be all fine, and not thinking about these little bottles and things. So we can send those around. And then also the information that we have, the doctors bring us in their presentation. Yeah, Mary Beth.
Yes, it comes in a lot of different, Nicole, it comes in a lot of different shapes and forms, like Caesar had mentioned. Up the street at our store, it was like bags and it looked like herb. It almost looked like weed. Like you could roll it or you could put it in your tea and different things. So it's hard to tell a parent what they're looking for because there could be so many different shapes and forms. And I have to say, working in this field, one of my biggest fears was they're going to use it and we can't test for it, which is kind of scary. However, I did go online and we found a dipstick that we can do because we do urine test our residents. But I can't prove if it works because I'm not going to have somebody smoke some kratom so I can dip it. You know what I mean? But we do have the dipsticks, but I can't guarantee, if they work or not. But that's the scary thing is it comes in so many different shapes and forms.
Well, the other scary thing is there really isn't research to confirm, for instance, is there, and I don't even know the answer to this, is there a safe amount? Is there an amount that is safe to be ingesting for whatever you would use it for? Are you beyond that? I don't think we know any of that part, and that's very concerning.
I am
Nicole,
Dawn. I'm the health. Oh,
Sorry.
sorry. I'm the health director in Chelmsford, so I certainly want to thank Lisa and Caesar for leading the way for most of us, and then having us look into this and find out what's going on. As Lisa mentioned, we did have 6 convenience stores that were selling kratom, and it was in all different forms. It was, as Mary Beth had said, just little bags, but they call them a tea. There are ones that were literally in a box, just like the tea bags are sold in. And then there's the drinks. There was like, I at least 20 different varieties of the kratom that was in the different convenience stores and the smoke shop that we have. So it's a little bit difficult to get all the different styles that it's being sold in out there to be able to educate the parents. But I think it's just letting them know that it can be in any type, in any form, and just getting out there. And when we were doing our research after we had spoken with Lisa and Lowell, and all my board members did their research too, the federal government is saying that it's not recommended, but nobody, as Attorney Ryan said, has come up with the study of what is safe and what is not safe, right? When it comes down to that quantity. So that's one of the biggest reasons that we regulated it, not regulated, banned it, the manufacturing and sale and distribution in Chelmsford, because we don't know with no matter who takes it, how much is going there that they can take it and it's safe. So we have proof that people be hurt by it, addicted to it, and that the death certificate of someone passing from it. So it's a big deal. So I did want to thank Lowell for leading the way. I know you mentioned Belchertown had done it, but I did not know that Belchertown had. So I thank Lisa, and I know some of my board members even called to get some more information from them. So if you need any research that we've done, I have it all on file. I can send you what we have. There's packets like this that were in there was 3 different board meetings, as I think Lisa probably had 4, and more information would come to us. Whoever wants it, I can certainly send it. It's a pretty big file. But that's all I wanted to share.
Thanks, Donna. I'm happy to see Dr. Chai with us. Dr. Chai, folks have so many questions for you this morning. Dr. Chai and his colleague, Dr. Suzuki, will be joining us to talk about both some more information just about kratom and their concerns for the future around these substances. Dr. Chai is an associate professor of emergency medicine and medical toxicology at Brigham and Women's Hospital or Harvard Medical School. He's additionally appointed to the Koch Institute for Integrated Cancer Research at MIT, the Department of Psychosocial Oncology at the Dana-Farber Cancer Institute, and the Fenway Institute. His lab conducts research funded by federal research organizations, the industry, and foundation partners to apply technologies to understanding and responding to changes in disease. As a toxicologist, Dr. Chai's group also investigates the development of new drug delivery systems and the repurposing of existing drugs to treat substance use disorder and mental health. And he's going to be joined by Dr. Suzuki, who is the founding director of the Division of Addiction Psychiatry in the Department of Psychiatry at Brigham and Women's Hospital. He is also an associate professor of psychiatry at Harvard Medical School. He is board certified in psychiatry, addiction medicine. He practices as an inpatient addiction consultant at Brigham and Women. And over the course of his career, Dr. Suzuki has successfully launched numerous treatment programs, including a comprehensive outpatient dual diagnosis addiction clinic at Brigham and Women's Faulkner Hospital and a low barrier, low threshold harm reduction bridge clinic at Brigham and Women's. He is the inaugural program director for the Brigham and Women's Addiction Medicine Fellowship Program, and he's very active in medical student, resident, and fellow education. He received the NIH funding continuously since 2017, having completed a K-23 Career Development Award to receive training in conducting clinical trials with an emphasis on research to improve the care of patients already in the hospitals. He's now a principal investigator on a number of NIH-funded trials evaluating novel pharmacological and psychosocial treatments, primarily for opioid and alcohol use disorder. So, Dr. Chai, I think we're going to start with you, and thank you so much for taking the time. I know you were busy this morning, for taking the time to be with us.
Thank you, and thank you all for having us today. I know Joju will be joining in a little bit, but I think this is a great kind of opportunity and a timing to kind of discuss the kind of the emergence of kratom, especially in Massachusetts. And so, as background, you guys heard I practice in the emergency department, but also I'm part of the poison control center here in the state. And if there's ever any questions regarding any of this stuff, the poison center is open 24/7, and there are fellows and toxicologists on call to answer these kinds of questions. But I thought we could use this kind of as an open forum for all of you to ask questions, whether medically or around the epidemiology of what we're seeing in our hospitals. But I can start briefly with an overview of what kratom is and its origins and where it came from. And so, and also please stop me if you've heard this before and you already know this. I'm not here to repeat things. So kratom is a plant, Mitragynous speciosa. It's endemic in Southeast Asia. So like we see elm trees and maple trees here in Massachusetts, they see kratom trees. And the leaf itself has several kind of active compounds. The one that is of most interest to us is something called 7-hydroxymitragynine. And so that compound binds the opioid receptor and is a partial agonist, very similar to buprenorphine or methadone. It's a long-acting opioid and can cause most of the kind of downstream effects of euphoria, so feeling kind of relaxed, and also helps with pain. And so for decades now, kratom, because it grows endemically in Southeast Asia, is widely used as a pain medication, to think of it as a medicinal tea. It's steeped in hot water and people drink the tea. People also use it widely for opioid use disorder. It's highly effective as a treatment for opioid use disorder and helps prevent continued use of injection drugs and other illicit drugs. Over the past decade or so, there has been a movement to bring kratom to the United States, given our issues with opioid use disorder. And it's found in various forms here within our state and across the country. So as you all know, there are gas stations, head shops that are selling kratom. It's I will note it's not FDA approved and it's scheduled by the DEA, but you can buy it as a quote unquote herbal supplement. And so the common things that people ask us are, okay, so if kratom works so well in Southeast Asia, why are we seeing so many problems here in the United States? That's likely because the kratom we see here is not the same as the plant or the the medicinal version of it. These compounds are dried, and likely they're plant matter sprayed with different kinds of drugs on them. And so we did a study out of UMass where we purchased kratom from several different head shops across Worcester and sent them for analysis with a colleague of ours who runs like a national kratom analysis center. And we found that the majority of kratom products, this was now 5 years ago in Central Mass at least, were contaminated with 7-hydroxymitragynine. So they were artificially kind of enhanced for that opioid-like effect. And I think that explains why at least here in our state, we see people who are trying to turn into kratom because obviously there are, many barriers to seeking medications for opioid use disorder, but are getting in trouble with adverse events. So the common things we see from in our emergency departments and from kind of the tox standpoint are individuals can present with seizures. You can get toxicity to the heart. And it's important to note that, I'm not sure that that's related to, quote unquote kratom, but it's probably the other things that are in it. So we found, increased concentrations of mitragynine. Likely there are other things like K2 or different bath salts within it. There may be other opioids like fentanyl that contaminate these things because there really is no regulation. And so that's, I think, the biggest issue right now. I know Joji and I had pulled some data from our MGB system from the Brigham, and over the past 5 years or so, we have seen a steady increase in patients who are reporting the use of kratom. We have very few people who have, what we would call term like a kratom use disorder, so like an addiction or dependence on kratom. Majority of people that we see are turning to it as, an adjunct or something to help with their opioid use disorder, given the fact that it's a longer acting opioid. It tends to work really well, assuming you're actually getting what you think you're buying here in the state. So I'll stop there, and I'm happy to answer questions or if there's anything else all of you want to discuss. I hope that's helpful.
That was very helpful, Doctor. I think we had lots of questions in part about, we talked a little bit earlier about the fact that there aren't really a lot of studies. We don't really know sort of what's a safe amount, if there is a safe amount. And then obviously, if it's been tainted with other things, that completely changes the picture.
Yeah, so great questions. It's difficult to study because unlike a drug where, for example, we can study a medication for high blood pressure because it's a FDA formulated medication and we have a consistent dose that we're giving somebody, it's very different here because the way that most people use kratom is you take a few leaves and you steep them in hot water and you drink it, and if it works, then you're at the right dose, and if it doesn't, you add a few more leaves, right? So it's very subjective. The plant is a tropical plant, so we're never going to grow it here in Massachusetts unless there's a significant warming of our
Global
state.
warming takes
Yeah,
off.
so maybe. So I won't say no, but it's a tropical plant, so it's not like where people are going to import and grow it. It's a large tree. It's like a maple tree. So that's not going to happen. And the other issue, the reason that there are not a lot of studies is because it's scheduled by the DEA. So that essentially means that the DEA has decided there is no medicinal purpose for the drug. So it's a Schedule 1, similar to the cocaine. And so it's difficult to do studies on it because it's hard to get federal funding or state funding to do research on, for example, how could we potentially think of kratom as an adjunct to buprenorphine or replacement for buprenorphine or methadone for individuals who have opioid use disorder? I think that's one of the kind of issues. The other thing I think, Marion, that you're pointing at is that we do not have good epidemiological data about what is happening across the country, but also, for us within Middlesex County and within the state of Massachusetts. That haven't, Joji and I have talked about initiating some kind of surveys and trying to buy some of these things from our communities to see kind of what is actually in the kratom that's being marketed, but that is also highly dependent on the supplier, right? So depending on the supplier and the thing that you're buying, there may be something else in it. There may be other drugs, there may be nothing. It might just be plant matter, there may be cannabis in it, and so it will require, I think, some ongoing surveillance.
I think one question that was raised was, given that, you know, they're selling this in stores all over the place. They've got sort of the coffee kratom rooms, if you will, that sort of thing. What do you recommend in terms of what we're telling parents about what to be thinking about, how to talk to their kids about it?
I mean, I'm a parent as well, although my children are younger. I hope they don't get into kratom yet. But I think as the same as we would counsel our children regarding, you know, other supplements and things that are purchased. I think people take for granted that you think you're buying kratom or you think you're buying whatever herbal supplement, but we really do not know what is actually in it, and that's where people get into trouble. So especially with children, most of the kind of adverse events of contaminated kratom that we know about in the United States have been related to children, probably because the dose that they're getting, they're smaller than us, and so their dose per kilogram is a little bit higher, and so they can get into trouble. So I think it would be it's important to kind of counsel our kids and our parents to know that you know, while they may hear things on social media about kratom, especially coming out of Southeast Asia and its effects, it's not the same thing that is out on the streets. There's probably other drugs that are within the kratom that people are using. It may be artificially kind of boosted or contaminated, and all of these things can lead to kind of downstream health effects.
Other questions?
Doctor, based on the data that you have, is this something that's being used nationally?
Yes, yes. I think there's renewed interest given the opioid epidemic and the lack of, you know, consistent access to medications for OUD. And most of the suppliers are national distributors. So unlike other, you know, we have local flavors, for example, of fentanyl here compared to New York, compared to California. Um, the kratom we suspect is likely very similar across the country. We don't know for sure, but that's our suspicion.
And are there steps that are being taken? Maybe this is part of, you referenced this a little about the substances, things like methadone. Could this turn into something like that?
It's hard to say. It's possible. You know, I think there's going to be, you know, I think we're probably a good 5 or 10 years away from doing something like that. You know, we'd have to, in the U.S., we'd have to figure out a way to, you know, develop some kind of consistent dose, you know, a pill or some kind of formulation that allows us to consistently dose individuals, and then we'd have to do a study to see whether that is something that is better than buprenorphine or methadone, or just as good, or works for certain subsets. So, you know, it is potentially a treatment. I would say it's not in the near future.
Other comments, questions? Yep, Maureen.
Good morning, everyone. Thank you so much for this presentation. I've been seeing, as Caesar has, I've been seeing kratom in stores for years. It started with vape shops, smoke shops, mostly powder. And if I can get this up in front of my camera, if you go into a convenience store, gas station, mini mart, you will undoubtedly see this. This is in almost every store I go into, with the exception of liquor stores and grocery stores. So it's a bag, it's usually green, looks like this. But then we started to see it in capsule form, and there were extracts and elixirs, and this is kratom soda, kratom chews, and of course, kratom vapes. If it's a vape product and it's flavored, then people like Caesar and me can enforce it, but all the other products we can't, of course. I share this information with my boards of health. Some are interested in a kratom ban. We talked about it at a regional meeting last week. And so this information is very helpful for me to pass on to them, because there is interest in taking a look at some of these products that have just, you know, I don't know, exponentially increased in our stores. And it is of a concern to to me and people who do my kind of work. But again, we're in the tobacco lane, so we have to hand this off to somebody else to work on. We just see it, want to share the information. So again, this morning's information was very helpful. And then just one last thing, Marion, thank you for your opening comments, but I do want to correct you on one thing. It was a whole team of people who worked on Somerville and got Somerville to pass nicotine-free generation. I just want to give a shout out to Caesar, my colleague, Bonnie Carroll, but there's Mark Gottlieb from Northeastern and Kate Silva and Anthony Ishak from Brookline and Dr. Jonathan Winikoff for MGH and a whole bunch of people. It's a team effort, and I'm very grateful to have the opportunity to work with them on this, on nicotine-free generation, but also in our conversations, since we share information about other things that we're worried about. And so I will also take this information back to that group. So thanks very much.
Well, you're always very gracious about that, Maureen. I stand corrected, but you are a great leader and you've been leading this effort for a long time.
Thank you.
Doctor, I see you now twice. Do we think is that Dr.?
I think that's Joji.
Yeah.
Yeah, he just
Yeah.
texted me and said he's having trouble with his video. Joji, are you there?
My apologies. I don't know if you can
Oh, you're
hear
there.
me.
Oh, good. Perfect. Perfect timing. Doctor, we've already, folks have already had an opportunity to learn a little bit about you, but we're happy to have you here with us this morning.
But my apologies. My video is not working and I'm showing up as Peter. So I have
That's
no idea
okay.
what's
We
going
work
on.
together a lot.
Yeah. So sorry I was late in joining.
That's all right. No worries.
Joji, do you have any comment? We've been talking mostly around kratom itself, its medicinal uses, and the controversies around contamination of kratom products, especially within our state. And from your addiction lens, I talked a little bit about, that we're not seeing a lot of kratom use disorder, but we're seeing people using it as an adjunct. And I don't know if you have any comments on that that would be helpful for the group.
Right. So historically, we've always been aware of kratom because it's, fairly well known among the individuals who use opioids, that it can be used as a sort of a self-medication harm reduction approach to self-medicate withdrawal, that sort of thing. But also, as we all know, it's been available as a sort of a wellness product to, improve mood and pain, that sort of thing. We were always concerned that it could really become a problem, but in previous years, it never had. But things have changed pretty dramatically in the last couple of years, actually. And so our clinical staff are definitely noticing that more and more patients are actually showing up to treatment because of actual problems with kratom itself. So historically, if somebody endorsed the use of kratom, it would have been in the context of somebody who already had an addiction, who is trying kratom because they felt it was a safer alternative, for example. It was pretty rare for us to encounter individuals who would say they're addicted to kratom itself, whether that was the only opioid they ever used, for example. That was relatively uncommon, fortunately. But definitely we're seeing a transition happening in the last couple of years where we are seeing more individuals who are endorsing that kratom is what they're addicted to. And part of the concern is this sort of the adulteration issue, whether is this a, more potent kratom product and, the ease of access, that sort of thing, or is that this, issue of the adulteration and the 7-hydroxy, which is, at least in my mind, that's probably the more urgent sort of concern that we've had, because definitely our patients are reporting that they're, these pure 7-hydroxy mitragynine tablets, for example, are, a very different type of a compound. And very different from the sort of the kratom powder, kratom extracts. They have their own issues, but I think some of the evolution in the products available today are raising some concerns. I don't know if Peter, you mentioned the quick chart review that we've done, looking at all the MGB. So for the Mass General Brigham, we looked at did a quick scan of our medical record to look at the number of times kratom was mentioned in emergency room visits. And we have data from 2017 up until now, and there's been a steady increase over those years. There's a slight dip during COVID, but there's been a significant increase in that entire time. After a period of being relatively stable, there's been a significant increase. And so, we're concerned that we're definitely going to be seeing more and more of this, again, in particular in the context of the 7-hydroxy or the adulteration of the kratom products. And as I just heard that tail end of this issue of vape shops turning into kratom shops. And that's definitely a pattern that we're seeing. We're doing this sort of secret shopper thing right now. We're trying to go into these vape stores and ask what they have, and our research staff is sort of trying to collect some, bit understand, what's going on out there. But yeah, it's raising some concerns. Now, I think there's, of course, there's legitimate, issues around, are there safe ways to, provide these products and make sure they're being regulated and tested, and I think those are important considerations, in terms of, is this if it's manufactured properly and there's sufficient warning labels, etc. Is that sufficient or not? I think those are important sort of considerations. So I'll just kind of stop there. Again, sorry that my video is not working. And
No worries, no
yeah.
worries. Any additional questions, comments?
Nice.
Yeah, Nicole.
Based on the data that you were referencing with the emergency room visits from 2017 now, is there a trend that you're seeing age-wise for those that are, it mentions kratom?
That's a great question. We haven't looked at the a deeper dive into the data, but that's a great question. I'll be asking folks to look at that. We're collecting demographic information, but right now the quick scan we haven't stratified by age. But that's a great question. Presumably, it's going to be the younger age. I mean, that's going to be my guess, like so many other substances. But that's a great question.
Mary Beth,
Oh, I
did
will
you have a
tell.
question?
Sorry.
Oh, sorry, Doctor.
Nicole, I will add that through the Poison Center, anecdotally in the state, most of our kratom related calls come from people who are younger in their 20s to 30s who are turning to it as, part of a getting in trouble, drinking at a party, for example. We are seeing it kind of come into the scene for these college and a little bit older kids. I don't know if we call them kids anymore, but.
Mary Beth, did you have a question?
I did, thank you. I'm just questioning, you're talking about at the emergency rooms and so forth. Is this all from self-reports, or is there testing going along with when they come in, if someone's overdosed or anything? Is this something that's starting to be tested for in conjunction with other substances?
It's a great question. Oh, Joji, do you want to answer that?
No, I'll just say that we don't routinely test for it. These are all self-report. There are tests available, but this is not, even asking about it is not a routine part of a typical clinical assessment. I think in the work that we do, because we address, substance use disorders, it probably comes up more often. But it's not, asking about kratom is really not part of a routine assessment done by, a hospital clinician, for example. So if it's mentioned in the chart, it's almost always because the patient sort of reported it, and most clinicians aren't going out of their way to look for it, and certainly not any kind of routine testing is really conducted. And Peter would know more about the emergency room, obviously.
Yeah, so our clinical drug tests do not test for kratom or its metabolites, the 7-hydroxymetrogynine. We do have there are it's not a common test, so it's very expensive to do, and usually gets sent out. So the results, if we were to send them, the results would come back with after a few days. So clinically, it's not a helpful test to do, but from a survey perspective, it's definitely something we would be interested in kind of thinking about. We have a few colleagues who do kind of kratom testing, and so we would have sources that we could send raw product to, as well as patient samples if there's interest.
Any other questions? Dr. Shai, Dr. Suzuki. Oh, I'm sorry. Somebody have a question? Karen,
I
did
think
you have a
Karen
question?
has a question.
I did. Thank you so much. This is fascinating to me, so I really appreciate this information. I'm thinking about making sure I have conversations with school nurses. Is there any plans to sort of transfer this information or sort of cautionary information at a state level to, again, school nursing staff, college health centers, because it sounds like that's the age demographic. That was question one. And then question two is I'll do my own research. I'll go into some of these places in my community, but I'm wondering about the price point. Does this tend to be a fairly inexpensive product to purchase?
As to your first question, we're happy to make everything we have from today available, and we will send it out to our counterparts. We meet quarterly with general counsel from the colleges. I'm happy to send it around to the school superintendents. I don't know, I would leave it to Dr. Chai or Dr. Suzuki or Maureen about the prices, but I think when you think about kids going and buying, you know, $6 or $7 drinks at Starbucks, this is not a lot of money.
I was
Right.
okay. Yeah.
Yeah, from my understanding, a sort of a heavy use pattern would lead to several $100s a week, and that's what I'm hearing. But I'm not fully sort of aware of all the different products and their price points. But my understanding is that people who get into problems with this get into problems pretty quickly. And again, sort of a several $100s a week would be sort of the upper range of what people are going to be spending. Like, for example, some of these drinks, you're only supposed to drink like half a can a day. But when you talk to people who are getting into problems with it, it's escalating it very quickly, several cans or more per day. And yeah, so it's not $700 a day. That's the kind of numbers we would see for very heavy use of other types of really problematic substances. But I think for Kratom products, it hasn't reached that level just yet.
Dr. Chai, Dr. Suzuki, thank you. Thank you for being with us today. Very helpful information. Thank you.
Thank
Yeah,
you.
thanks for having us.
Thank you. We will pull together all of the information we have about this. We'll get it out to our list. We'll send it out to as usual, to our police chiefs, school superintendents, so they'll have that. I really want to thank all of you really for raising this issue. This is a great use of the task force when people have questions or start seeing things, and we can pull experts together. So thank everybody for being here this morning, and we look forward to seeing you in April. Thank you. Take care.